especially when you look at the regulations that were written in the 1990s. But here's the thing, they're ruling on some very basic analytic data. They're saying that you can put cookies on there, you can track, you can look at your analytics, you can put pixels so that you can have effective advertising, and you can customize. But they're talking about a ruling that's based on old technology. This is current stuff that's been around for a decade plus. What about all the technology that's coming down the pipeline? Because we don't know what that personalization experience is going to be. And it feels like HHS and whomever needs to update HIPAA and the rules and regulations and make it more clear or broaden it so we're protecting patients, but at the same time we're able to give them the best experience that they get when they are shopping for shoes or planning a vacation or picking out a new home. Hey there, welcome to the Dr. Marketing Tip Show. I am Jennifer.
And I'm Corey.
And today we're going to talk about something that I think is big for us, big for medical practice marketing, but probably didn't get a lot of press. And really what we're talking about is back in late 2022, Health and Human Services, HHS, issued a ruling that was questioning whether or not web tracking or cookies on websites and really customization, which is modern marketing, was a violation against HIPAA. And the American Hospital Association has sued HHS basically and has gotten a ruling back in March now of 2024. The ruling just came out. And basically the judge has said, hold on HHS, this is an overstep. This is not a HIPAA violation. And although this starts now in Texas, there's other states that are talking about it as well. And it has big implications from a marketing perspective, specifically for healthcare marketing.
Yeah, and to zoom out a little bit and kind of frame this conversation, the what is and is not HIPAA compliant is always a little bit murky when it comes to marketing. But I do think that this is a win for marketers, because this essentially is saying, in Texas anyway, but it's most likely going to expand, that we can use these tracking technologies and therefore provide sort of customized experiences because of those. So how that applies in sort of a day-to-day example would be, you have a patient that goes to your website and maybe you are, let's say, an orthopedic surgeon. They click on partial knee replacement, and maybe they download a guide that you have, or maybe they just look at the partial knee replacement page and then they leave and go about their business. And then you later serve them an ad on their social media channel of choice. There's talk about whether that is or is not a HIPAA violation, because technically I'm receiving that ad because I looked at something on the website. I could argue as a potential patient that that's medical data because I looked at the website. And so again, it gets a little murky, but that is a very real example of marketing that happens all throughout the country.
Yeah, and I think if you go back even further, the rules for HIPAA were written in the 1990s, which is 30 plus years ago, before the internet that was invented by Al Gore. And so basically you've got, and rightfully so, and this is a good thing that the hospitals have done, but the hospitals argued that we're not able to customize the experience, to look at usage that's good to our business bottom line, that isn't PHI per se, and that we're not doing anything wrong. And thank goodness somebody took it all the way to the court, because this really does have implications that have downstream effects on all those small practices that are just trying to get by.
Yeah, I mean, going back to that same example, if I go to that page and maybe there's a quiz or a guide or something like I'd mentioned a minute ago, I download the guide, I've got the guide now. Maybe that comes with an email sequence that I unknowingly opted into. I didn't pay attention, I didn't read the fine print. I get an email that says, hey, thanks for checking out the guide on partial knee replacements. Well, if I leave my computer open, my partner comes and she sees that and says, oh, I didn't know you were having a problem with your knee. So technically, is that a HIPAA violation? Because you sent me this customized thing and now it's out in the open, and so that, again, that's sort of been the conversation around customizing these experiences, because you can imagine that depending on the subspecialty, that can be a very different conversation between a knee replacement and something else.
Yeah, and bringing it to the day-to-day of what we deal with, we had pretty extensive conversation about, is using Google Analytics, which is a free service, a HIPAA violation. And we were talking about, in order for us to keep pricing low, we utilize tools like Google Analytics. Plus, it's the number one tool out there, and it's what people are used to seeing. So if we're producing reports and adjusting analytics and adjusting strategy based on data that's coming into us, and now we're no longer able to do that, how would we actually be able to make decisions from a marketing perspective moving forward? And we talked about it. We said there's some tools out there, but those tools are very cost prohibitive, which means we're going to pass that on. So not only are practices dealing with all the other regulatory environments that are adding costs to their bottom line, now on top of that, they're not able to market their practice.
Yeah, there are tools that market themselves as, for example, like HIPAA compliant search analytics or HIPAA compliant website analytics. But yeah, they are very expensive, and their data is limited because they have to be HIPAA compliant. In response to this, not directly this, but just this general conversation, Google has also done some things, with GDPR and some of the other privacy concerns that are sort of swirling about. Where when we look at reports now, a lot of what we see, we used to be able to see traffic sources pretty clearly, and we could say, oh, this came from an email, this came from social, this came from organic referral, etc. Now, depending on the website and depending on the users, what we'll get on the report sometimes is something that says not set or none, and that is where a bulk of the traffic comes from. And that's because the browsers, again, with Google Analytics, have said we are not going to allow cookies, or cookies are not accepted.
I always accept cookies.
Yeah, so do I. Because we want to protect the privacy of our users. For example, so Safari on your phone, you may have unknowingly either opted into or out of tracking. And so if you do that, then everything that shows up on that report is going to say none. And so I think that this ruling is kind of a step towards maybe refining that a little bit and still giving users a good experience, one that is safe and secure, but can also be customized and unique to them if they want it. And I think that that's really the key, is finding that middle ground, which is going to be different for everyone. Because if you're the hospital or you're the independent practice, you're going to want as much data as legally possible to make the best decisions. And if you're a patient, some patients are going to say, I got nothing to hide. I want that experience. I want the full boat. And some patients are going to say, I don't want anyone to know anything about me. So
for me, it's a great ruling. Hopefully it spreads everywhere, because at least for me, it feels like an overstep by HHS, like trying to say, square peg into a round hole type of thing. Especially when you look at the regulations that were written in the 1990s. But here's the thing, they're ruling on some very basic analytic data. They're saying that you can put cookies on there, you can track, you can look at your analytics, you can put pixels so that you can have effective advertising, and you can customize. But they're talking about a ruling that's based on old technology. This is current stuff that's been around for a decade plus. What about all the technology that's coming down the pipeline? Because we don't know what that personalization experience is going to be. And it feels like HHS and whomever needs to update HIPAA and the rules and regulations and make it more clear or broaden it, so we're protecting patients, but at the same time we're able to give them the best experience that they get when they are shopping for shoes or planning a vacation or picking out a new home.
Exactly, yeah. And I think it all comes down to consumer choice and the consumer decision, because really when you're a patient, that's what you are now. You're a consumer. And so if you opt into this and you say, sure, I'm cool with the tracking, then I think that's great. And then marketers and hospitals, independent practices, everyone should be able to say, okay, we can serve you a really good experience that's tailored to exactly what you need. Keep all the junk you don't need out of your feed, out of your life, because you're not interested in those things. Whereas the flip side of that is we can't track, so you're just going to get everything, and good luck.
Yeah, that's the case. And so I think, it's probably a little known decision that not everybody, probably not many people at all had it on their radar, but it is big news. the Hospital Association one, it's a starting point in Texas. I think for, everyday practices, keep doing what you're doing, keep refining, and know that the rules and regulations are changing, and we got to pay attention to it.
Yeah, and pay attention to those reports too, because if you're getting a report from your marketing folks and you don't really pay attention to it until it's time for a board meeting, these kinds of things will sneak up on you when you realize that you don't have the same data that you used to.
That's right. So with that, I'm Jennifer.
I'm Corey.
We'll see you next time on the Dr. Marketing Tip Show. Thanks a bunch.
Bye, guys.
If you want more like this, hit like and subscribe so you'll always be alerted to new episodes when they come out. And if you want information about us, visit us over at insightmg.com. That's insightmg.com. We'll see you on the next episode.